Chaplain Doug Overall, Director of Spiritual Ministries at Good Samaritan Loveland Village in Colorado. Welcome to an overview of critical incident stress management for healthcare, EMS, and caregivers. Critical incident stress, sometimes referred to as traumatic stress, affects nearly 90% of all healthcare employees, emergency personnel, and first responders. Critical incident stress comes out of physical, cognitive, and/or emotionally charged events. The effects of critical incident stress can be intensified, influenced, or mitigated by our personal, family, and developmental history, issues, and experiences. Critical incident stress symptoms usually subside within a few weeks. Now, some examples of critical incident stress: an injury or death of an infant or child, a death or cumulative deaths of patients, residents served, someone known to the healthcare agency, the department, or EMS personnel, an employee, colleague, EMS worker, or a first responder. Extreme threat of safety and/or threat to a healthcare employee, EMS worker, and/or a first responder. And then finally, an example of critical incident stress would be disasters, mass casualties, COVID-19, and critical incidents that draw unusual media attention. Now, some of the signs and symptoms of critical incident stress: they usually start within 48 hours of the event or the crisis or the traumatic event. Many feel excessive fatigue because of sleep disturbances, maybe having too much sleep or too little, maybe having recurring nightmares, and because the critical incident or events are all consuming. Another sign or symptom: some may experience flashbacks to previous events, experiences, and/or losses. There may be some vague health issues such as headaches or GI upset. And then there can be at times some changes for the coworker or the worker on the job performances, one's attitudes and/or behaviors. What we need to remember is these signs and symptoms of critical incident stress are normal reactions by a normal person to an abnormal event. Some of these symptoms are physical, and these physical reactions may include, but not be excluded to these: hyper or hyperactivity or periods of depression, may be oversensitive or have a hair trigger, anger. Some may withdraw and seek isolation. Others may have strong feelings of guilt or fear or helplessness. Some can have the inability to concentrate or short-term memory loss. Nausea, upset stomach, sweating. Heart rate and blood pressure increase. Muscle soreness, fatigue. Some report having twitches, constant thirst, headaches, dizziness, fainting, and the grinding of teeth. Some of the cognitive symptoms, reactions, could be impaired thinking or decision making, poor concentration or memory loss, difficulty with abstract thoughts, or flashbacks, poor attention span. There can be time distortion, meaning either time is going too fast or it has slowed down to a crawl. There can be perception alteration. For some, there's the blaming of someone, difficulty identifying people or objects, nightmares, intrusive images, or disturbed thinking. Some of the emotional reactions of critical incident stress Could be anxiety, guilt, fear, a sense of grief, sadness, depression, emotional numbing, the inability to feel, a sense of feeling lost, abandoned, helpless. Some report a sense of wanting to withdraw or anger regarding the event. Feelings of numbness, shock, overwhelmed, while others may have a sense of denial, uncertainty of the present and the future, apprehensiveness, irritability, or agitation. Research has shown that behavioral reactions are also possible from a critical incident: withdrawal from coworkers, family, or friends, a change in activity, one's speech or patterns of behavior, emotional outbursts, suspiciousness, loss or increase in appetite. Some choose to self-medicate either through alcohol consumption or drug use. There can be the startle reflex is intensified and the inability to rest. And yes, there can be spiritual reactions to a critical incident. Questions with little or no answers. For example, is there a God? Why me? Will life ever be worth living again? Intense anger or rage with God, one's church or faith groups. There can be that search for meaning and purpose. The questioning of religious experiences, one's faith traditions and or values. So the question, what can help when I experience a critical incident and its results in critical incident stress? Well, there can be two approaches. One is proactive and one is reactive. The proactive approach provides pre-crisis preparation, education, training. There are peer and organizational support, and the research and development provides encouragement and insight into preparing for critical incidents that may occur. And then there's the reactive approach, the actual interventions to help address critical incident stress. For example, on-scene support, one-on-one individual crisis intervention, disaster interventions in the midst of the crisis. Critical incident stress diffusings is an intervention, as is critical incident stress debriefings. And then, of course, follow-up and referral resources made available to employees. Let's look at some of these critical incident stress management interventions. The first one we mentioned was on-scene support. That's where peer support personnel, could be nurses, CNAs, social workers, chaplains, or other clinicians. They briefly assist obviously distressed coworkers, usually by moving them away from the scene or providing added support in the midst of the crisis. On-scene support may also provide assistance to victims, family members, and bystanders to reduce interference with ongoing operations. Critical incident stress diffusings is a very powerful intervention. It usually occurs within 1 to 4 hours of the event or within 24 hours following the event with the healthcare personnel that was specifically involved with the critical incident stress event. It is led by a trained critical incident stress management facilitator. The goal of a diffusing intervention is to stabilize the healthcare workers, the team, so that they can, 1, return to normal service and duties and responsibilities, or 2, go home at the end of their shift. The diffusing intervention is usually a small group process that usually takes 30 to 45 minutes. It involves the initial venting of feelings and thoughts and or concerns. During the diffusing intervention, educational and resource materials are made available to all those who are participating in the diffusing. And then the contact person and a number is provided to each employee for additional support and or encouragement if necessary. The critical incident stress diffusing involves and has an educational component about stress and stress-related reactions to the event and the crisis. It concentrates on the most seriously affected healthcare employees. And it either eliminates the need for a formal critical incident stress management debriefing, or it enhances the debriefing process to be scheduled at a later date. The critical incident stress debriefing intervention is a structured confidential group meeting for those healthcare employees directly involved in the critical incident stress event. It is best offered within 24 to 72 hours post critical incident stress event or crisis. It lasts approximately 3 hours, and it is facilitated by at least 2 to 3 trained critical incident stress management personnel. It could be a nurse, a chaplain, and a social worker, or a CNA, a chaplain, and a bereavement coordinator, but usually 2 to 3 trained critical incident stress management personnel who are trained in the process of a debriefing. The goal of a debriefing is to reduce the impact of the critical incident event and to accelerate the normal recovery process. It emphasizes ventilation of emotions and other reactions to the event. The critical incident stress debriefing emphasizes educational and informational elements in order to help understand and deal with the stress generated from the event. It provides an opportunity for stress reduction, education, emotional reassurance, enhancement of group cohesiveness, and interagency cooperation. It also provides referrals for individuals to other supportive services if deemed necessary. Critical incident stress management interventions. It may also include the following: follow-up services with additional meetings, special debriefings for non-emergency community groups, special debriefings for the spouses and or family members of healthcare workers and employees, and it can also provide individual consultations. One last word. Okay, let me share 2. First, from Jeffrey Mitchell, founder of the International Critical Incident Stress Foundation. He has defined a critical incident as, quote, any situation faced by healthcare workers and or emergency service personnel that causes them to experience unusually strong emotional reactions, which have the potential to interfere with their ability to function either at the scene or later. Now in closing, let me share the following. The physical, emotional, and spiritual well-being of our healthcare workers matter, and we must do everything within our power and scope of care to support, encourage, and tend to their wellness needs as they seek to fulfill their various roles and responsibilities, serving our residents, their loved ones, and each other.